Hello everyone. Welcome to Dr. Bob's Medical Insights, where we make medical knowledge simple and easy to understand. Today's topic is abnormal vaginal bleeding, a common concern that can happen at any age, but often causes worry and confusion. We'll explain what counts as abnormal bleeding, its possible causes, and when you should seek medical help. Abnormal vaginal bleeding means any bleeding that happens outside your normal menstrual cycle, or bleeding that's heavier or longer than usual. This includes bleeding between periods, bleeding after sex, bleeding after menopause, or very heavy, prolonged menstrual flow. There are many possible causes, including hormonal imbalances, especially during puberty, perimenopause, or from birth control use. Uterine fibroids or polyps, non-cancerous growths inside the uterus, endometrial or cervical problems, including infections, inflammation, or precancerous changes. Pregnancy-related causes, like miscarriage or ectopic pregnancy. Medications and bleeding disorders can also contribute. Sometimes the cause is mild, but other times it can signal a serious underlying condition, which is why evaluation is essential. You should see your doctor if you experience bleeding after menopause, very heavy bleeding, soaking pads hourly, bleeding lasting more than 7 days, dizziness, fatigue, or pale skin, bleeding during pregnancy. Treatment depends on the cause and may include hormonal therapy to regulate cycles, medication to shrink fibroids or control bleeding, surgical procedures for growths or structural problems, iron supplements if you've lost a lot of blood. Early diagnosis and treatment can prevent complications like anemia and fertility issues. Track your menstrual cycle regularly. Maintain a healthy weight. Avoid smoking and manage stress. Get regular gynecological checkups and pap smears. Abnormal vaginal bleeding is not something to ignore, but with the right diagnosis, it's usually treatable. If you're experiencing any unusual bleeding, see your doctor or gynecologist promptly. If this video helped you, don't forget to like, subscribe, and share for more health insights from Dr. Bob.